Obesity is a condition where there is too much fat in the body, and the person's weight is higher than what is considered healthy for their height. A body mass index, BMI, over 25 is considered overweight. BMI is calculated by taking a person's weight in kilograms and dividing that by their squared height in meters. Body mass index, BMI, above 30 kilograms per square meter is classified as obese. Obesity can increase the risk for many health conditions, including heart disease, diabetes, high blood pressure, kidney disease, arthritis, fatty liver disease, high cholesterol, sleep apnea. Obesity is usually treated with lifestyle modifications, including dietary changes, exercise, and behavior therapy. Weight loss drugs and bariatric surgery may be considered when lifestyle modifications don't yield a loss of at least 5% of total body weight at 3 to 6 months. When the stomach is empty, a hormone called ghrelin is released, which triggers hunger and prompts food-seeking behavior. Once food is consumed and glucose, sugar, levels in the blood rise, the pancreas releases insulin. Insulin helps to regulate the increase in glucose and signals the brain to stop seeking food. The small intestines release a hormone called glucagon-like peptide 1, GLP-1, which slows down the rate at which food passes through the stomach, prompts the pancreas to produce more insulin, and contributes to the feeling of fullness during and after a meal. However, the effects of GLP-1 only last 1 to 2 minutes. In summary, these hormones collectively control the sensations of hunger, the act of eating, and the feeling of satiety. Ghrelin initiates hunger and insulin, and GLP-1 assists in managing fullness during and after meals. Obesity significantly increases the risk of developing insulin resistance and type 2 diabetes. In obese individuals, the pancreas releases reduced amounts of insulin, and this insulin has a weaker effect on the tissues. Thus, obese patients usually present with hyperglycemia or high levels of sugar in the blood. 1. Hunger hormone, ghrelin, is released from the stomach and sends hunger signals to the brain. 2. High levels of blood sugar, glucose, are found within the digestive system. 3. A lower amount of blood sugar regulation hormone, insulin, is produced by the pancreas, leading to glucose imbalance. 4. Fullness hormone, GLP-1, is produced by the small intestines but has short-lasting effects. Weight loss medications are a viable option for individuals striving to lose weight when lifestyle changes are insufficient. A prevalent type of these medications is the glucagon-like peptide 1, GLP-1, receptor agonists, which are also used for treating type 2 diabetes. GLP-1 agonists work by mimicking the action of a natural hormone in our body, GLP-1, which helps control blood sugar levels and appetite. One of these GLP-1 agonists is a drug named semaglutide. It's typically administered through weekly injections, which can be done at home, into the upper arm, thigh, or stomach area. GLP-1 agonists stimulate the pancreas to produce and release more insulin in a glucose-dependent manner. This means that insulin is released when blood glucose levels are high, such as after eating. Less insulin is released when glucose levels are low, reducing the risk of hypoglycemia, dangerously low blood sugar levels. GLP-1 agonists also promote the function of the pancreas. This is especially important in patients with type 2 diabetes, characterized by deficient pancreas function and reduced insulin secretion. 1. Hunger hormone, ghrelin, is released from the stomach and sends hunger signals to the brain. 2. High levels of blood sugar, glucose, are found within the digestive system. 3. Weight loss drug, GLP-1 agonist, is injected into the body. 4. A higher amount of blood sugar regulation hormone, insulin, is produced by the pancreas balancing out glucose levels. 5. Fullness hormone, GLP-1, is produced by the small intestines and is sustained by the weight loss drug, LGP-1 agonist. 6. Food remains in the stomach longer as GLP-1 slows digestion. GLP-1 agonists contribute to weight loss by slowing down gastric emptying, the process by which food moves from the stomach to the small intestine. This prolongs the feeling of satiety or fullness after eating, reducing overall food intake. It also reduces the feeling of hunger by directly influencing the appetite centers of the brain. These effects, in addition to the stimulation of the pancreas to increase the release of insulin, leads to blood sugar regulation and weight loss. Studies typically report an average reduction of approximately 10% to 15% of total body weight. The exact amount of weight loss varies depending on the drug used, dosage, starting weight, and if diet and exercise are also used. These medications are most effective when used in conjunction with a healthy diet and regular exercise. Thank you for watching. Please subscribe and like and leave your comments.